Hello and welcome to the City of Boynton Beach's Racial Equity and Social Equity Community Assessment Public Input Meeting. My name is John McNally and I'll assist with the GoToWebinar portion of today's meeting. Before we start, I'd like to review a few housekeeping items so those virtual audience members know how to participate. Your microphones have been muted to reduce background noise. There will be specific times during this meeting when audience members can participate. The first way is by typing your question into the questions section at the bottom of the GoToWebinar interface. Those questions will be read into the record by a meeting organizer at the appropriate time. The second way is by clicking on the raise hand icon indicating you wish to speak. A meeting organizer will announce the next speaker at the appropriate time and unmute their audio, at which time you should state your name and address for the record. Please minimize any sources of background noise and speak clearly into your microphone during your allotted time. I will now turn control over to David Scott, who will be presiding over today's meeting.
Thank you, John. Good evening, everyone. Thank you for coming out tonight to the city's Racial and Social Equity Community Assessment presentation. My name is David Scott. I'm the Director of Economic Development and Strategy for the City of Boynton Beach. And I have with me co-presenting is Dr. Maria Elcheva with FIU, Florida International University. So we just want to welcome her and her team to the City of Boynton Beach to present tonight on racial and social equity. Just a little bit of background. The commission, about 2 years ago, the commission asked the city staff to put together a task force around racial and social equity. We immediately partnered with FIU to work with us as that research university. With their experience in other places, Miami and other cities, they were the right choice for us. Our goal through this process is to make Boynton not only an equitable city, but really make it a place where people see themselves. We want everyone who lives here, who wants to move here, who wants to relocate here, who grows up here, to really feel a part of the prosperity that's happening in Boynton Beach. And it's important for us to understand where our blind spots are, what we could do better, and what we need to work on as a community as a whole. So Dr. Elcheva and FIU and her team have really worked over the past couple of months through stakeholder meetings, focus groups, and now in this public input meeting to present some of those findings. So at this time, I'll turn it over to Dr. Elcheva.
Thank you, David. I want to welcome you as well. We appreciate the time you're giving us to listen to the findings of the research that we've engaged in over the last 6 months. Really, it includes a lot of analysis, and I couldn't do it by myself. I have Alex here from my team and Lilian behind him, but we have other data scientists and researchers who on whose shoulders all of this data and much more in the final report and findings stand on. I want to mention also that Lilian will be distributing comment and feedback cards. So even if you don't wish to leave a comment on these cards, you can speak up, of course, at the portion of the meeting that we have allocated for your feedback. But give us your contact information so that we keep you updated on the next steps in our research when the report is made available. Excuse me. And we also have, as part of the public input process, we'll be launching a survey as well. So hopefully you will respond to that survey and you'll distribute it to your network. So we get different perspectives on the issues that we're trying to understand. And ultimately, all of this information will be of use to not just the city of Boynton Beach, but to community partners, to Palm Beach County organizations beyond just Boynton Beach, as they seek to address some of the challenges that we identify. So I want to say, next slide, just a few words about the process and the different elements of this research, this assessment, broadly speaking. So I already mentioned we're looking at all kinds of different data divided into 5 categories that we will focus on during this presentation. But in addition to the analytics, we really wanted the residents, some of you may be business owners, various community organizations, to hear, to understand some of the analytics and to give us feedback on. So be very open with us. Tell us if we're missing something. Tell us if there are any other issues that you think we should know about and we should look into. We're counting on you as community members also to guide us and to make sure that we are not remiss. And then all of this work, including the data analysis, the public input, will lead to recommendations to a plan, again, not just for Boynton Beach, but for the community to stand behind and to work on as you seek to address these challenges that we talk about in terms of economic opportunity or housing or health, any of the topics that we will be covering. Next slide. First, in this presentation, we'll be covering 5 pillars, as we call them, or 5 categories of data, five topics. And these pillars came about as a result of the process that your economic development director talked about, when the commission and the staff decided to pursue this work, to pursue equity, their work on equity in a very intentional and very structured way. And the identification of these issues is obviously an important part, because it helps us define what data we should look for, and it also will help you understand what we're presenting on, and possibly give you an idea of how to prioritize when we talk about solutions and implications in terms of guiding the city or community partners to work on. So very brief overview here. You have your presentation, the copies of the presentation in front of you. Those of you who are online, if you wish to receive a copy at the end of the presentation, you will see a slide with my contact information. You feel free to contact us. We'll send it to you. It will be publicly available for everybody to review later on. But as a general overview of these issues, I want to note that, again, we're looking at them through an equity lens. And when we talk about equity, we're not talking just about the typical focus on racial and linguistic minorities, but we're talking about gender equity. We're talking about all the groups that, as Mr. Scott said, should see themselves as part of Boynton Beach. So we focus, as you will notice, on racial or ethnic disparities, but in the report we talk about gender inequality as well, which is a topic near and dear to my heart. And although we don't include it in this presentation, I just want to, as a side note, to mention that pay disparities between men and women in Boynton Beach over the last decade have expanded, actually. In 2010, the pay gap was 9% for full-time male and female workers. Now it's, 2019, which is the latest data, it expanded to 13%. This is just an example of some of the equity issues that we're looking at, including how religious minorities are treated, or how these different religious groups see themselves, the LGBTQ community, again, all seniors. When we talk about equity, the point is we're not talking about just a specific group or limited groups of people. Everyone really should be part of the community. I want to note that Boynton Beach, and I'm sure you've seen it, as probably many of you are longtime residents of Boynton Beach, has changed significantly over the last decade. It has grown tremendously. One of the residents here mentioned that all of South Florida is really changing and is growing in population. But you see that in Boynton Beach as well. Quite significant change as of the latest 2020 census data that was just released about a month ago. The population of Boynton Beach as of April 2020 was just over 80,000 people. very, very significant growth. And the makeup of the city is changing. The most significant growth, even though they are not the majority of the population, is among Hispanic residents. We're seeing also an increase in Black and African American residents. But basically, it's becoming more diverse. Your city is becoming much more diverse. Very, very typical for, well, actually the way we describe it now is if you're familiar with Miami-Dade, Broward and Palm Beach are becoming more and more Hispanic, the way Miami-Dade was 20 years ago when it started with a large influx of Hispanic residents. There are also other changes that are occurring in terms of housing, in terms of economic opportunity, but we'll cover these issues separately in a little bit more detail. I want to mention that when we compare Boynton Beach to the county overall, it is not much, we don't see much difference in terms of median household income, in terms of the disparities that we will note throughout the presentation, and in terms of the proportions of populations that seems to be struggling the most, and their specific characteristics. So even though we focus on Boynton Beach, you can easily translate this data with very similar percentages, proportions to the county overall. Next slide. All right, with that general overview, now we will go over some of the findings, the highlights, the synthesis of some of the research that we've conducted. And you will hear us give references to the feedback we received through the stakeholder meetings and the focus groups. But Alex, my colleague Alex, will assist by presenting first on economic development, and then we'll cover the issue consecutively with him.
Hello, my name's Alex. Thank you for joining us again, everybody. It's a pleasure to be here with you. So we begin with the economic development pillar, primarily because it is such a foundational pillar to the entire assessment. And what I mean by that is so many of the metrics and data points that we look at in this area, they connect to a lot of the other pillars, whether that be health, criminal justice, housing. A lot of it has to do and traces back to the economic development of the city. So from the outset, one of the first things that we noticed is a disparity in per capita income along racial and ethnic groups here in the city. For example, in 2019, white non-Hispanic residents in Boynton Beach, the per capita average income was double that of Hispanic and Black residents of the city. We also find that aside from the initial disparity, the incomes of Black and Hispanic residents in the city also seem to be more volatile. So what I mean by that is in the long-term trend, when we see that drops in income occurred across the board for everybody, that drop was more dramatic, more significant for Black and Hispanic residents of the city. We also find that within Black and Hispanic community of Boynton, there are higher rates of poverty. Both of these metrics are more concentrated, that is lower incomes and higher poverty rates. Both of these things are more concentrated within the heart of Boynton area. And for anyone who might not be familiar, the heart of Boynton refers to the corridor between US 1 and I-95, as well as a strip that runs north and south along US 1. So we can expect that these disparities in this area are going to manifest themselves as other disparities within the other pillars. Part of our recommendation and strategy for this is, of course, supporting alternate sectors for people to work in that provide higher wages, more stability, more benefits. And that leads into our next finding, if I could get the next slide, which is the dominance of low-wage sectors within the city. So to begin with, we know that most of the Black and Hispanic residents here in Boynton Beach work within the retail and service sectors. These jobs are typically lower wage jobs. They're less secure jobs, less stable jobs. These are jobs that offer less benefits to their workers. It's about 8,000 workers in Boynton Beach that work within these sectors, and that's a substantial part of the workforce. At the same time, while being a huge part of the workforce, this is also a sector that offers some of the lowest median wages around. So what we find is that Promotion of alternate sectors, supporting alternate sectors is necessary so that we can transition workers from these lower wage sectors into better jobs. Now, we know that programs exist within the city that do this kind of work successfully, helping people train in short-term education and getting certifications to move into these jobs. So it may just be a matter of supporting these services further. Could I get the next slide, please? The third finding, general finding that I'd like to talk about in this pillar is a shift in consumer habits that we've witnessed here in Boynton Beach. So essentially what's happened is over the past few years of the pandemic, many of you may already be aware that a lot of consumers are shifting towards online shopping and e-commerce. Now, this is likely going to remain the case. Projections show that brick and mortar stores are not projected to do well in the coming quarters, and it's unlikely that these stores are going to retake the space that they once occupied in the minds of consumers, right? But we find that a much more granular analysis of this shift actually presents the city with the opportunity to kind of harness the momentum that's being created by this shift. So specifically what's happening is that neighborhood centers are becoming much less popular and their vacancy rates are increasing. And just to quickly explain, a neighborhood center is typically a standalone store with its own parking lot that isn't connected to any other stores. These stores are becoming increasingly less popular, and taking their place are strip malls. Strip malls are typically 10, 20 plus stores that are not connected to each other with internal walkways like a mall might be. It's more so sidewalks connect these stores, and they share large parking lots. They're often referred to as one unit. So we find that if the city is able to carefully monitor this shift, there is the opportunity to lean into the change that's happening with consumers. And this can help ensure that physical retail stores still have a place in Boynton Beach, as they do make up a significant part of the local economy. Our next pillar is education, and for that, I'll pass it back to Dr. Ilcheva.
All right, and you'll hear back from Alex on another topic. We left it kind of purposefully at the end, housing, that I'm sure many of you are eager to hear on what our findings were. But we thought first to talk, as it connects most directly with the pillar of economic development, about education. And many, you already heard Alex mention that many of the challenges related to economic development, economic opportunity, economic mobility connect also with education and workforce development in general. So when we look at across racial and ethnic groups, I'm sure you wouldn't find it surprising that we see a lot of disparities, which later on in life translate as they prevent economic mobility for certain residents, lead to lower wages and lower career growth potential. So what we are seeing in terms of the current residents of Boynton Beach is that white non-Hispanic residents are more likely to have higher educational attainment. In fact, about 37% of white non-Hispanic residents have a bachelor's degree or higher. Very similar, by the way, to Hispanic residents, but more than double the percentage of Black or African American residents. So there are significant opportunities there to elevate people's lives, individuals' lives and family in terms of income if we focus on elevating their educational attainment. And Alex mentioned we're not just talking about, we don't necessarily need to talk about your traditional academic education. In the current world, certifications, micro-credentialing, all those short-term opportunities can lead to very rewarding careers and high-wage jobs. And you already have, we spoke with some of the providers in the area in our stakeholder meetings. They're already thinking in those terms and focusing their efforts on such opportunities. But education is not just about the higher degree, right? We should also talk about education at the lower levels. And next slide, when we look at the data in terms of, we don't show it here, in terms of high school graduation rates, suspensions, all kinds of adverse school behaviors, again, we see significant disparities. the graduation rates of Black and African American students are significantly lower than those of Hispanic or white non-Hispanic students. It's not race or ethnicity that generates that disparity. It ultimately connects with our first pillar, economic development. So the disadvantaged students are typically the ones who are less likely to graduate and to have these adverse school behaviors. Yes, sir. Yes. Well, we can modify it if you all want to get in. Yes, we have the opportunity, but we wanted to present first.
Instead of waiting for all 5, I can't remember that one. Not this. Well, just read it. So.
No, that's okay. We can go either way. If you want to ask a question now, you can stop me at any time and give a comment or ask a question. You can go ahead.
Dr. Acheva, this is John McNally. Just for the virtual audience's perspective, none of us can hear the gentleman's question. So if they do wish to make a comment or ask a question, use the microphone. Yes, thank you.
Well,
you can go.
Okay.
Or come up to the podium.
What you mean?
Yes.
Okay. I'm a little shy, if you don't mind. Hi, Ernest Magnoli, 710 Northeast 7th Street, Boynton Beach. So I had some comments and questions about Alex's presentation on the economic development of Boynton Beach, the way you were describing malls and strip malls and retail stores. And really, my comment is Boynton Beach has been developing for decades. And all of a sudden, it seems like all the programs are starting to think that everything that affects Boynton Beach relates to COVID. It doesn't. COVID has expansion problems before COVID, crime problems, lack of parking, density problems, travel problems, access to store problems, et cetera, et cetera. So what I notice in your presentation is you keep referring to, COVID changes. COVID's not responsible for everything. This was happening before COVID. I mean, crime has been around way before COVID, and it's a trend. But my point and my comment is, and I think my question is, that I think what I see the city doing is trying to create high-rise developments and bring in people from all over the country, whatever, wealthy people, and then try and create these buildings, high-rises, with ground floor exclusive stores for them. And then in the surrounding area, like Ocean here, where they're gonna now, they bought that restaurant, the CR program bought it and give it over, and they wanna put the high-rises up. So now they wanna start claiming Ocean Avenue here, not Ocean, yeah, this is Ocean, thank you. You know, and they're gonna take that house, that historical house, and they wanna take this and take that. And what do they wanna do? Well, you listen to them at the meeting, all they talk about, well, we wanna make it like a hot spot. We wanna be like Delray Beach. Boynton Beach doesn't wanna be like Delray Beach. We wanna be what this lady's talking about, a family town, a town for school, one-family homes, a lot of one-family homes. You know, the city can't take these high-rises anymore. I live 6 blocks away. It took me 20 minutes to get here. Every corner, you got to wait for this excessive traffic, and they haven't even built these high-rises yet. So, you know what I mean? I think enough with the emphasis on COVID. I think you have to reflect on the 6 years that this administration has stressed a certain kind of development and neglected the rest of us, which is everyday people, families, one family, apartment renters. That's what we need, affordable housing, et cetera. Every meeting I come to, they're talking about $2,000, $3,000, $4,000 rentals with malls and shops where you spend $10 for a glass of orange juice. I don't think that's it. That's my comment. It was too long. I'm sorry.
That's okay. Thank you for your feedback. We'll get back to that topic of housing later on. I just want to mention that when we talk about housing development, as you said, we want to make sure that we're addressing the needs of diverse residents, right? There is a need for different types of housing in different cities. Some of it is single family, some of it may be multifamily, some of it will be rental, some of it is homeowner focused. But we'll get back to that in the housing section. David?
I just want to change the format back to what it was before. No, thank you for your comments. I really do want to. I want Maria to get through because we do have a virtual audience. So just to keep some order, let's work through the presentation. Then we'll open up the comments for the folks here in this room, and then we'll open it up on virtual, if you don't mind. We just wanted to get through the presentation. Thank you.
All right, we'll get to your comments. I'll try to be brief. Alex and I will try to be brief from now on. I see you have some ideas already, and I don't mind going to that. You have the presentation, so you can review it and ask us questions later. Just to finish my thought on education, though, obviously we need to focus on education at all levels, from early childhood education, really, not just focusing on high schools or university education as a way for economic mobility. The next pillar, and I'll be brief on these two pillars, health and criminal justice. And I'll start by saying that they relate very strongly, again, with economic opportunity. So when we talk about, especially as we observe the disparities, the same way I mentioned, educational disparities are correlated with economics. We can say the same about health and criminal justice when we talk about areas. So first, on the topic of criminal justice, one of the main points in the summary slide that I made is the significant decline of crime rates, both violent and property crimes, over the last year in Boynton Beach. However, that's very true. Yes. However, and what we're seeing, that's not just over the last year, but there has been a progression, a decline over the last 5 years. So whether we can just assign it to COVID. But the important point is there are certain areas in which high crime rates have been the norm. And these are, again, the areas, the most economically disadvantaged areas. What you see on this slide in the presentation with the darker colors is the higher crime rate areas with the darker blue. Again, correlated, if we overlay the data that we have on poverty and household income, you will see almost completely matching those areas. We also see disparities, though, in the next slide. We also looked at juvenile crime. Similar to overall crime rates, there are disparities in terms of the statistics, the higher proportion of residents, of juvenile youth, who are committing these crimes are again from the most economically disadvantaged areas. So again, we keep going back to this issue: economic development, education, workforce development. They all correlate with the other challenges that some of the neighborhoods, the communities in Boynton Beach are experiencing. The next pillar, on the next slide, we have several of them. I'll just run through them very quickly. We focus on health. Similar picture, higher rates, lack of health insurance, lack of access to health care in certain communities, precipitated by their lower incomes, and to a large extent, as Alex mentioned, because of due to the types of jobs, the types of occupations and industries in which some of these residents are employed. Healthcare benefits and other benefits are not very typical for tourism service related sectors. Many employers don't provide them, and that's obviously producing these adverse statistics, particularly for Hispanic and Black Boynton Beach residents. Next slide. See, where are we? As a result of lack of affordable healthcare and health access and lack of healthy behaviors, we also see high incidence of disease and consequently higher rates, death rates among those residents, again, correlated with healthy behaviors, correlated with their income, with their ability to get food, to engage in these behaviors, and lack of education. Next slide. All right, the final slide here is on health that I want to emphasize, and we heard a lot on this topic from us in the stakeholder meetings, in the various stakeholder groups, even those who were talking about economic development or about education. They mentioned mental health as one of the increasingly of the challenges of the community. I want to note again, and apropos to what one of the residents said, this is not an issue created by COVID. Mental health awareness and the lack of access to mental health services has always been an issue, right? Many health insurance policies don't even cover these types of services. People are, there is a stigma associated with depression and some of these mental health issues. But COVID did indeed magnify the issues. What we have in terms of the data is 2019, and even that shows that these types of behaviors, depressive behavior, depression and hospitalizations were on the rise. I want to mention again, you'll say I'm repeating myself too much, but very often, as I said, it's related to access to healthcare, but it's also related to stress. And what's the most common stress factor for families and individuals? It's usually lack of financial stability, lack of housing. Again, we keep going back to these topics. Next slide. All right. We'll skip this slide, but I just wanted to point out that when we talk about health, again, reiterate that we're talking about social determinants. And that gives us the segue to one of the topics, lack of financial stability, but also lack of affordable housing for many residents is creating health challenges, educational challenges, and is preventing them from leading productive lives and having good quality of life. And Alex will finish up with housing, and then Sir will open the floor and for others for your comments.
Right. So, okay. Housing is just one of the more complicated pillars, obviously, because we have issues that are specific to Boynton, but obviously, as most of you are probably aware, there is an ongoing housing crisis that is bigger than just Boynton Beach. So we start at a fundamental level, and we're just talking here about the ownership rates along racial and ethnic lines here in the city. So we know that in 2019, in the city of Boynton Beach, about 68% of white non-Hispanic residents own their home, right? When we look at the Hispanic or Latino community, that number drops down to about 52%. And when we look at the Black community, that number drops down to about 40%. So there are significant disparities there. And, we always talk about owning a home as this sort of standard of wealth building, of stability for families. And that in and of itself is a substantial thing. These disparities become more concrete, however, when we factor in the cost burden factor. And for those of you who don't know, households that spend 30% or more of their income on housing costs, whether that be rent or owner-related costs, these houses are considered cost burden. Now, we find that within the renter population, there are significantly higher proportions of cost burden households. Also within the renter population, there are higher proportions of Black and Hispanic residents. So you see the connection there. Could I get the next slide, please? Now, moving on to our next finding is the broader, more larger market factors that are at play here in Boynton and across the region. So put simply, rent and home values are skyrocketing, okay? You see here this figure about homes selling above listing price. Also, currently, rent in Boynton Beach is past its historical highs and continues to climb. And I should note that this is happening at a time when already, previous to this spike in rent costs, over a third of renters in Boynton Beach were spending more than half of their income on rent. So this is an issue that has been exacerbated by the current market, but it existed already. Could I get the next slide, please? Oh, this slide moves into our next point, but I just wanted to make one final point, which is about the affordable housing issue, which the gentleman brought up earlier. So once we start to speak about the affordable housing issue, we realize that this whole pillar, the issue in this pillar involves a supply side issue as well. Through our discussions with stakeholders, with community organizations, with workers, we found that there is much difficulty in securing land and units, housing units, into the affordable housing pool. This is a problem that workers are encountering from all ends of the problem. Between out-of-state movers, developers, speculators, investors, it's becoming a very competitive market, and we're approaching the point where local residents are just being priced out of that market. We recommend, a specific recommendation that we've made is the development of a community land trust or a land bank. And put simply, this would be a nonprofit organization that through the support of the city would be able to acquire units and land, hold them in perpetuity and manage these lands, and then affordably rent them or sell them to residents here in the city. They would also then be in charge of the sale of that land or unit in the future. So this would ensure that not only would we develop a pipeline now for affordable housing, but we would also be able to sustain it in the future. And on that note, we're going to now move into our next phase of the discussion. I'll pass it back to Dr. Ochoa.
I just want to mention you all have these in front of you, and if you can just skip to the next one, so our online audience can read it over. But I want to tell you what the next step is for us. So we kind of went through it very quickly, and we gave you the highlights, summarizing many of the findings. We have a lot of more data. It's truly a comprehensive report. But as you noted, it becomes overwhelming, especially as we talk about so many issues with so much data that describes these challenges. What we are doing now is compiling all of this and preparing the next step, the implications and the policy recommendations that we've alluded to throughout as we describe these challenges. This report will be submitted to the city by in early January. It will become part of, it will become a community document where you can all get the data. You can look at the complete analysis, and ultimately what we're recommending as next steps for, again, the city and community partners. A lot of these issues, they were not caused by COVID. I want to emphasize that, but they were also not caused by, just natural progression. They're the problem of systemic challenges, of institutional challenges that have existed in our society, in our country for decades, friends. And it's not that we're going to resolve them with this report, or the city can wave a magic wand and solve all of these issues, but it's a starting point. It gives us as a community the foundation and the common understanding on what are those most pressing challenges. And based on the progress that the community makes as we track changes over time, we'll be able to determine whether we are successful in moving the needle in a positive direction.
Thank you, Maria. Very good presentation. Excellent job as usual. Maria did say something that I just want to emphasize. We've asked FIU to help us with this baseline information. And once those baseline metrics are established, we can check ourselves and our progress over the next couple of years. Maybe in 2 years out, we'll go back and look to see how well we've done, or whether or not we need to readjust on certain issues. And then we'll check again in another few years periodically. We want to make sure that we are really focused on those initiatives, actions, policies that can make a difference or get the biggest return on our investment in the community. So with that, we want to open this up to questions. We ask that you, if you can, we'll come to you. If you can't make it to the mic, but we ask that you come up to the mic, state your name, and make your comment. We're going to limit everybody's comments to 3 minutes just to give everyone an opportunity. And then we'll go forward and we'll talk to the people here, and then we'll open it up to the virtual audience. So thank you.
Okay. This is not a miracle. I can stand up. So, you know when you've seen a miracle. I just wanted to congratulate you for such a wonderful initiative. Very ambitious, but it's a wonderful initiative. And I just wanted to bring up a few points. The first one, that is, if you know the makeup of your community, that some of them are Spanish-speaking people, and some others are Haitian Creole or Haitian French Creole, how are you gonna call them? Why don't we have interpreters for them? We want more participation from the community. That's the first thing. The second thing is that you are focusing on race and ethnicity. I love the charts and the statistics and everything, but you're not talking about language. I have not heard one word about language. So if you want to really address the healthcare issue, which is a very difficult system to navigate into as an English speaker, can you imagine if you don't speak the language? By the way, a phone call is the most difficult thing for a non-English speaker. So if we talk about the healthcare and equality, and I love the word that you said, it's equity. It's a beautiful word that you're using. So don't even want to address the mental health part of it, because the culture and mental health is, it's a very great area. But I just want to suggest to please address the language issue, because that's the most difficult to, if you want to accomplish what your mission is here, you need to address the language issue. It's the number one thing. So.
All right, thank you for your comments. If there are any of you who didn't catch any of the presentation because of my my English speaking rather than Spanish, both Lilian and Alex speak Spanish. So if you need any translation, we can provide it to you right here. But I hear you in general, especially since the community is changing. We need to adapt to that, and we need to make sure that residents who don't speak English very well, they also feel welcome and part of the community and have the opportunity to express.
Very scary when you don't understand the language and try to participate in all these initiatives.
I want to also address the other comment that you made, because that's something we are focusing on related to healthcare access for residents who don't speak English, not just Hispanic, but Haitian Creole, and from other cultures and nationalities for whom English is not a native language.
I just want to say one more thing. I didn't say that before. But, oh, thank you very much. So you don't want to see another miracle, right? So what I wanted to say also is that this is temporary. So the thing is that being a wheelchair is also giving me another beautiful opportunity to learn what the needs of the people with disabilities live through. So my name is Berta Ceballos. I'm not promoting myself, but I'm a professional interpreter, English, Spanish, and in medical, and a court interpreter for many years, for 20 years, and a community advocate for 20 years. So I know the needs of the community. But thank you for the opportunity.
Excuse me, can we get your name for the record?
Berta, B-E-R-T-A, Ceballos, C-E-V-A-L-L-O-S. And I'm a proud resident of Boynton Beach for 4 years, and I would love to participate in the community and the efforts that you are trying to accomplish.
Thank you very much. Just very quickly on the issue of the health profession. That's one topic that was covered in one of our stakeholder meetings about the lack of diversity in the health profession. We're not just talking about interpreters, but we're talking about doctors, nurses, other medical professionals who need to look like the community in which they work, to which they provide services. And that's something that our medical professionals from the institutions that we engaged, they're fully aware of, and they're trying to address, including FAU, FAU card, right, Lillian? We interviewed them, and they gave us a lot of feedback on that, and the work that they're doing is really excellent in that regard.
Thank you.
Before you start, if you could just state your name and address for the record of anybody who is speaking, that'd be fantastic. Thank you so much.
Yes, good evening, and thank you. It's been a beautiful presentation. My name is Lydia Maldonado, and I live in 5119 Mirror Lake Boulevard. I'm a social worker for mental health. We call them clients, and also a pastor of a Spanish congregation here, local. As I was going through everything that you said, and also an ex-retired teacher from Miami-Dade County, the education part, I'm very concerned about it, but I really believe if we were to pour more money into vocational schools, that's a big key, because we can graduate students with a diploma, plus they're going to have a career in their hands. And I think that's something we need to think about and start building on that. When it comes to the health issue, well, we do have Obamacare, and there is a lot of help if people really seek it. Okay, because I have taken a lot of people to hospitals, and there's been cover for that. When it comes to the economics, it's true. We have a lot of elderly in our communities, and remember, a lot of the jobs that we have are caregivers, and caregiver jobs are minimum $10 an hour. Okay, plus you have to pay your own taxes because they don't take taxes from you. So having such a great so many people who are elderly, we have to keep in mind that that brings a lot of low income, we have. With the crime, I believe if we were to add more police to the streets, that's going to help us with our youth. And I'm glad you mentioned before that you are having activities here like once a month. And that's great. We need to bring our youth together. We need to bring our community together. A lot of the Hispanic kids, instead of going into gangs, they can benefit from a lot of this stuff. A lot of Black kids too. And I'm telling you, a lot of my clients are young kids. And when I see these kids that really their problem is mental health and it's not being addressed as mental health, they're just being thrown in jail and nobody's doing nothing about it. And really they're sick, they need help. And I think we need to pour more money on that too. And let me tell you something. I've been to Tallahassee many, many times lobbying for a lot of these bills. And to be honest with you, I am not going to stop. The elderly in our community needs to be taken care of. Right now, to get a one-bedroom apartment in Boynton Beach, you need to have an income of $23,000. When you have an elderly living in a Social Security check, you cannot do that. I have several clients that I need to move and I cannot move because they don't make enough money in order to get a new apartment. So anyways, those were my thoughts. Think about it. And I'm with him, it's great. I went to my downtown Palm Beach about 3 years ago. And when the man who has your position, Mr. Sanchez, says, we're not going to have malls in 3 or 4 years. I almost freaked out because I am a shopper at the malls. I love malls. And now that I go downtown Miami, there's nothing there. They took Macy's and everything. Our mall is almost gone. Please keep us on stores. We need stores here. Thank you so much.
Thank you for your comments. There was a
Good evening, everyone. I'm Bishop Bernard Wright. I'm CEO of Bernard Wright Ministries, Real Talk Radio, and the Robert E. Wells Foundation. And I'm your current candidate for mayor here. I just want to ask, when you all was doing your research, who were the stakeholders of Boynton Beach that y'all consulted with in respect to, not in the data, but who are the stakeholders? Because I've been in this city and I'm going to have a legacy here, and I've been with my advocacy here for quite some time. And I was never even told about the study till I saw y'all coming through the city, just not a couple of weeks ago.
Yeah, thank you, Mr. Wright. We were very purposeful in who we selected. Yes. We were very purposeful in who we selected as stakeholders. We wanted to make sure that we're broad and inclusive. So we included people with disabilities, LGBTQ community, as well as the Hispanic community, the Black Haitian, Black American. We really were purposeful in who we got involved. So from the heart of, right, that's the stake. No, I'm talking about the stakeholder group. So they were really people from each one of those represented from each one of those areas. Specifically from the heart of Boynton, Ray Whiteley was part of that stakeholder group. And Reverend Dames. Okay, so I just wanted to let you know who those. But you just asked who the stakeholders were, so I was giving you the stakeholders, and there's a long list of stakeholders, but we can certainly provide you with that list of. No, we're talking about representatives from each of those groups.
So you won't go to one person as a stakeholder when you're trying to find out what's going on in the city.
We would,
and especially with my advocacy being what it is, you're not getting a mask down here. Not even brother when I finish talking.
Could you, all right, Mr. Okay. You're on the record. You're on the record, Minister. Okay. Thank you. Okay, got you. Is there anyone else? Okay, back there.
Hello, my name
David
is
Scott, this is John McNally. We're not able to make out any of the conversation. If you have an extra microphone, that would help.
Thank you. The question was, do we want everyone to come to the mic? I'm giving people in the room a choice. We'll bring the mic to you, or you can come up to the mic, either way. So go ahead, sir.
More so statements. My name is Jannard. Address is 520 Northwest 13th Avenue. I own Jay's Tri-County. I'm a contractor, HVAC contractor, and my mom, she does a nonprofit organization, Helping Hands for the Purpose. And you guys did a wonderful job with the statistics. I actually used to be a part of these statistics, but I think my main two concerns are education. And one thing I didn't see you guys do or say is the things we should do to help. My mom, what she does is back to school drives. She just did a trunk or treat for Halloween. And I think we should do more things to help the community. As he said, we're supposed to be a family. You know, Boynton, it is a small community. I think I moved out of this state and to Pennsylvania, which is a small, Latrobe, small community, and the people that are more friendly there. And I think we should be more like them, or say. That's all I have to say.
Thank you.
Thank you for your comment. Just to mention a few of the recommendations related to education. We're talking about after-school programs as one of the recommendations. We're talking about a revival of a youth center or something similar that can help the youth engage in productive activity. We're talking in the recommendations about mentorship. One of the residents, the lady mentioned vocational training. So we're thinking about programs that lead directly into careers, into well-paid jobs. So these are, examples of the things that the implications of this data that will be included in the report. But thank you. You're thinking along the same lines as us. Thank you very much. Yes.
Hi, Ernest Magnoli, 710 Northeast 7th Street, apartment 407, Boynton Beach, Florida. I moved and bought here October of 2020. And I have to say, what I like the most about this city is the families I see here. And I don't look at it by color or economics. There's just a tremendous amount of wonderful families here with little kids, et cetera, et cetera. And for me, even though I just turned 73 and I'm physically handicapped pretty bad, this is a perfect community for me because I thought I want to fit in with families, help when I can, and sort of deal with some of the issues that I see in the city. And a lot of what I see is overdevelopment, catering to like millionaires and billionaires from all over the world, pushing out wonderful families, and big safety problems. And I don't know if I'm allowed to say it, but I think there's a lot of crime and corruption in this city. And I'm willing to stand behind my accusations based on facts. I try and come into meetings, but I find that the present council is thankfully the mayor's leaving. I know you're not allowed to say that. They don't like you to say things, but I'm glad he's gone. I hope the city attorney goes with them because I don't see them doing anything for just average people here, like me, handicapped, older people, families, little kids. I don't care that they're building a restaurant and a high-rise across the street with $60 dinners and $6,000 a month hire. They're bragging about this here. And then what they're doing, they're allowing developers to come in and buy big tracts of land with private houses on it, throw everybody out, and put up high-rises or convert those nice apartments, if they just fix them up, convert them for the average people. What kind of city is it that average people can't find a place to live for $1,000, $1,200 a month? Even that's expensive. But those people are looked down on in this community now, the way it's being set up, like, oh, if you're not rich, really move on because we want to make Boynton Beach Delray Beach. The other thing is, this whole thing about crime is way off. I don't know where you got your statistics, but this thing is horrible. It's way off. And the other thing is, there's a lot of crime if you come to the meetings with the city actually committing crime with their own police and firemen and bias hate crimes and lawsuits and settlements and police getting fired for taking drugs, et cetera. Well, you're not allowed to talk about that.
Thank you. Maria, you want to just address the data?
This is official data. It doesn't, it's the data that the city reports in the uniform crime report. So we didn't make up the data. We're just reporting it the way we see it.
Do we have another comment?
Yeah. Excuse me, Bishop Bernard Wright, 713 Northwest 2nd Street. I kind of agree with the young man that's got through speaking in certain respects about some of the things going on in Boynton Beach when it comes to our municipality. That because of a key word, ineffectiveness. It's been that ineffective for decades because what we have over in District 2 is disenfranchisement. And this is all about economic and social equity. There could be no social equity if there's no economic justice for economic equity. We haven't had that in District 2. So for you to talk about a one Boynton, and we're talking about, addressing this equity issue, which we're talking about systemic racism, especially, no doubt about it. When we look at Boynton Beach and the different districts and where the money has been spent, like he said, about the rich folks. Developers come in, they always want money, they get it free. They always get TIF dollars. They get all the land free, and they're developing. We need development over in District 2. Everything they're saying in these papers in respect to racial equality, economic, judicial, and otherwise. That's why I'm saying, what stakeholders you talking about? I've been in and out of the penitentiary all my life. Do I know how we should construct so that we can produce when they convicted felons come out, and then they could get their rights restored, and they could become self-sufficient? Hey, anyone can't do that. I'm here to be able to see that we have what we need to do that. I like everything is on this paper in respect to this city. And what they're saying, most of it is true. But I want to know how we're going to get the resources, and that is the finances, to make this thing happen. To God be the glory.
Yes, sir. Thank you. Any other comments in the chamber here before we move on to the virtual?
Hi, my name's John Fitzpatrick. I live at 64 Relaxed Circle. And I don't know really, I look in the North End, they built a beautiful, on Northeast 7th Avenue, I believe it is, a beautiful 300 units of low income project. It's a first class. I would live there tomorrow if they'd let me move in. I don't qualify, but the point being, we are as a city putting money into areas in the north end of Boynton Beach, above Boynton Beach Boulevard. And yes, there are some condos that are being built that are bringing money to the area, but the city of Boynton Beach just borrowed, or is in the process of borrowing, $3.5 million to buy property on Ocean Avenue. We need developments like that down at Woolbright, so those tax dollars can support other programs, low income programs here. And also, we're talking about all the problems, but I'm not hearing anybody coming up with a solution to the problems. And that's where I like to look at, where can we get solutions, not sit here and bitch and complain.
Thank you.
Thank you, sir. We're still finalizing the solution, so we're giving you kind of the big picture view. We included some of them, as the Reverend mentioned in the presentation, that we just didn't go.
Sorry about that. You know, another problem we have in the whole state of Florida is every day 1,000 people move to the state of Florida from up north, from New Jersey, New York, Wisconsin. They're coming here and they're zapping up the property. What do? Do we put a fence on the state of Florida and say no more people can come here? That's really a problem.
Thank you.
Maria, if you want to, then we'll move on to virtual.
I would like to make a comment to the bishop there. A pleasure to meet you, sir. I believe that if we, the church, would get together and really start moving around with the youth, that can be a great help. And unfortunately, our church have become afraid of going out and knocking on doors and letting people know that we're here for them. And that's what's happening. There used to be a time when the churches used to run all the social programs. Now we leave everything to the government, and it's our government. It's about time that we go back again to us and let the government deal with its own business. So my suggestion is, let's start rattling the church more, get all the pastors together and see how we can help the community with more social services.
Thank you, ma'am. We're gonna move on to our virtual audience right now. So let me move on to the virtual, and then we'll see if we have some time. We can come back for additional comments here in the chambers. So, John.
Yes, we have a few comments online. I know the first hand up was Patrick Lopez. I'm going to unmute you now, and you should be self-muted right now.
All right, so yeah, I just had a couple of questions because a lot of the information coming into the slides are taking some very large assumptions. One of the assumptions is basically you're just going across 2 or 3 data points on racial classes. I don't even see any Asian, maybe some Pacific Islander like my wife is. Her family came over prior to any kind of racial inequity. So I guess the tax dollars that we put in, if we haven't came in and we had no part of it, Why should our tax dollars go to something like this? Another reason might be is some of the issues that we're looking at is from a results standpoint, when we need to see what's going into it and why those results are happening. Maybe it has to do with not having a family unit of a father and a mother in the family. Maybe it has to do with initial personal choices that they made, especially in the juvenile to anywhere from 18 and up. I know me personally, when I turned 18 and I was going to college, I saw September 11th happen and I joined the military. Me coming out of the military, I went back and I went to a 4-year degree and I went and got my college degree, and now I'm working, I'm making money, but those are personal choices I made. Now, so I make more money and you take more tax money from me. Now because people made horrible personal choices, either alcoholism. I mean, I have mental issues too, but one thing that goes and compounds those statistics is that you have them separated. When I know that there's multiple people that not only have mental health issues, but they're also having alcohol issues also. So I mean, and that compounds the numbers to how many are going to actually be hospitalized. So I mean, it's just, to me, it looks like it's a lot of garbage in, garbage out. You're taking things, or you're making very large assumptions, and I think a lot of this has to do with personal choices. And if we can't teach people, or we can't parent our kids from an initial standpoint, then nothing that you guys are going to do from a government standpoint is going to do well. Okay, the government's very ineffective at things that they do. I know that from being in the military, and I know that from doing government contracting as of yet. So I just don't understand how you think, as a city of Boynton Beach, that you're going to forecast and have some results in 2 to 5 years, when you're talking about you need to start early, and you're not going to have results for 30 to 50 years, and then you're going to have taxpayers on the hook for all these programs and all these changes and all these different programs that you're going to say, oh, we need to make a little change because this ain't working, but on the same time, we're on the hook for it. It's just, I just don't understand.
Well, thank you for your comment. You made some very good comments, but I will let Maria touch on a few things for you. Although the Asian community was not mentioned, they were also included in our research as well.
Can you hear me? Yes. I want to address the issue that you mentioned about the compounded problems, and that's indeed a word that we use. We see the intersection, I mentioned it several times, of economic development, education, family conditions, as you aptly noted, childhood trauma, early childhood education. All of these topics intersect. The issue is that if we continue not paying attention to them, if we don't dedicate any resources to treating these issues in a kind of comprehensive way, by understanding that they indeed are related, our community is not gonna prosper. And ultimately, what we're doing with the data is simply, as I think you alluded to it, we're simply illustrating the outcomes, right? We know that there are challenges. We know that these challenges didn't emerge because of COVID, that they weren't created by the city. A lot of them have been decades-long challenges for the community. But again, we need to focus, we need to build that foundation, that understanding of what the issues are, how they relate to each other, and then direct resources in an appropriate way and track progress. That's important as well, to the extent that we're able to see results in 2, 3, 5, maybe some of them will take, as you said, 10, 15 years to resolve. But simply saying that, it's kind of defeatist, right?
No, I would definitely say that there's currently federal programs out there. There's HUD programs, there's SBA programs for 8A, small disadvantaged businesses. There's different types of programs and federal dollars out there right now that companies can go get, or personal people can go get. And I don't understand by trying to go ahead and say we need a certain equity. It doesn't have to do with equity. We don't need equity. We just need equal opportunity. If we have a problem, if a person right here, person A and person B, goes through the same life, do the same choices, and go through the same style, and then we have different outcomes, then we might have something to talk about. But we're comparing apples and oranges, and I don't think that's fair to make assumptions like that and then say that we need to make monetary investment into something when there's programs out there that are already currently doing it. And I think that taking our tax dollars, our hard-earned tax dollars, right after everybody's coming out of a pandemic, people didn't have jobs, and you're going to go in and we're going to do some social justice program. I mean, I just don't understand it. And I mean, maybe you can explain it a little bit better to me, but I think that there's other ways that we can go ahead and we can turn our money and use our tax dollars wisely on things that are going to be way more effective for the city of Boynton Beach residents.
We're gonna move on, but I do want to respond to what the point you just made, and just be clear. Because we are coming up with these recommendations, the city already understands that we can't do it alone. It is not for us to try to do and take on all of these issues and challenges that have existed for centuries. They're systemic, they've been here. It is our job to recognize them and then find partners that can help us move the needle. And that's what we're talking about today. Here's the data. We're sharing it with the community. There are community partners that are already out there doing the work. And if we work together, we can help make Boynton a better place. So that's the goal. That's really what we're looking at. And to the gentleman's point, we aren't looking for the city to fund all these programs because, as you said, the city doesn't have the resources to do all of this. But the city is helping us, working with FIU to identify those challenges and then work with our community, whether it's federal, whether it's state, whether it's county. There are a lot of private institutions out there that do work. There's a lot of nonprofits out there that do the work. We're saying, here's the challenge. It's job creation, it's economic development, it's housing. How can we all work together to address some of these issues and make it better for everyone? So I just wanted to respond to that, John.
Yes, we have a few other hands raised, and I'm going to unmute Wayna Dunmeyer. You should be now self-muted.
Hi, can you hear me?
Yeah.
Hi, my name is Winna Dunmeyer. I live at 84 Maple Lane in Boynton for almost 20 years now. I'm grateful for the committee for coming up with funding after school programs. I think that's a great idea. Also encouraging trauma-informed care for any of those programs, which is a very important component. And specifically as a parent raising children educated here in Boynton Beach, I really encourage connections with the public schools here in Boynton Beach, Florida. I have a child at Congress Middle School, and I know that they would be happy to reach back if the city did reach out to offer services and programs and opportunities. So thank you for doing this, and I'll continue to be a part of it as much as I can. Thank you.
Thank you.
Yes, next we have Brenda Williams. You should be self-muted.
Am I able to be heard?
Yes,
Are
ma'am.
you? Okay, I'm Brenda Williams. I live at 337 Northeast 24th Avenue, and I've lived there since 1975. And a lot of the things that the city is doing in that area is the first time that any road construction has been done, sidewalks put over there on the area. And that's one of the main things that we have been advocating for years, about sidewalks going to Galaxy Elementary School. So when you talk about housing, I don't like the idea of having a land trust, community land trust, because when you build a house on community land trust, the person does never own the house. I mean, never own the land. So what is the point of building a house and if you try to sell it years from now, you can't sell the land. The land is not part of the ownership of the property. So that was another thing that I'm not in favor of doing any type of community land trust building. Also, I think that with the monies that you're talking about is from the pandemic that we're supposed to be getting back, right? Is that the case?
There is a link to the ARP money, but specifically we're just focused on the programs and recommendations that are coming out of FIU to address some of the equity issues. So the
Because
funding
I didn't see the agenda, and nor did I see any of the recommendations, nor was I any part of your panel of people that I'm like Minister Wright now. You're going after people that don't have history in the city of Boynton Beach. All they have history is from where they came from. And a lot of times you're overlooking the history of this city. I don't like all these high rises. I don't like all these buildings that were being built, and the vacancy rate is so high, and you keep building more and more. What is the point in doing that? Fill up the ones that you already have and then go after these others. I hate all these concrete buildings that we're building, messing up our community from whence it came. So those are the points that I wanted to bring out. And I also am in favor of whatever you can do about health issues, because we have to go so many different places other than, there's nowhere in Boynton for people to go. And that's another thing that we had been advocating for years, getting some type of a community health place in the city of Boynton. So I guess I'm finished.
Thank you. No, very good comments. Thank you.
Yes, next we have Halo Kramer. You're now self-muted. Ms. Kramer?
I think you hit me again. I think you hit me again.
Thank you so much. I think everyone can hear me now, yes?
Yes, ma'am.
Thank you. This is Bayla Liza Kramer. I'm in at 6094 Brightwater Terrace in Boynton Beach. I speak from a perspective as a former public servant working for the New York City mayoral administration, passing their mandatory inclusionary housing and zoning plans. And I speak from a perspective as a not-for-profit professional and also as a former staffer in the New York State Assembly. What I'd like to echo back are some of the comments that folks made about, and I'd like to kind of reframe them by saying that I am not against development, and I am for community engagement to make sure that communities arrange for special agreements with developers as they come into their communities. One of the things that the city has an obligation to do is to act as oversight, but also convene teams of local residents to meet with the local community. And the community needs to be educated on how, because I myself am learning, needs to be educated about how to ask and what to ask for. And the city elected officials can stand behind their constituents in advocating. One of the big changes that has been talked about are the changes within the demographics. And I'd like to reinforce what one of the people said about there not being conversation Southeast Asian or Asian or South Pacific Asian Islander communities. And even though they represent a smaller demographic, they too are engaged in community business in a way that can lead the community as it advocates for the improvements like the former woman was discussing about having community centers and making sure that there are opportunities for people who are moderate and middle income to enter these high-rise buildings in ways that they can sustain. I also want to echo her comment about the importance of generating programs that create generational wealth. And land trusts can be modified in a way that give families an opportunity to do that. So I'd like the city to please look at some of the best practices and also call upon me personally for advice as I served as a community board member in Brooklyn, New York for over 15 years and on the land use board. So you have a lot of intellectual capital in the community of professionals who want to act as a bridge between the community and those who seek to invest and thrive in it. Thank you so much for the opportunity to address all of you, and thank you to the people at the university who are truly seeped deeply and conscientiously in this inclusionary process.
Thank you very much for your comments. Very well spoken.
Next up, we have Glenn Weiss.
Can you hear me?
Yes, sir.
Okay, hi. I'm city staff, but I was curious after listening to this, and that is, where's the sixth pillar, and that would be social capital. Where is the connection between people through churches or clubs or golf courses or whatever, however they do it, and has that been improving or declining? And how does that tie into all these other issues? So I just wonder where that is.
That's an interesting question. I don't get asked very often because most people don't understand what social capital means, but that's what we're trying to build here, right? We mentioned that community engagement process and trying to bring stakeholders from diverse perspectives and residents to speak on these issues. Social capital is, for those of you who are not familiar with the term, is about creating these community connections, building that trust so that the community can move forward as a unit without leaving anyone behind, if we put it in action terms. We are not looking at it as a pillar, but rather as an overarching umbrella over everything. We do believe with this approach that the community needs to be invited to join alongside the city and community partners. And we hope by presenting this data, by raising awareness, and by asking for your input, that we're helping along with that social capital generation. Great question. Really appreciate that input.
I don't see any more hands raised at this time, but I do have a comment or to comment I want to read into the record. It's from Eunice Jean Jacquez, 1 Vera Wood Way, Boynton Beach, Florida, 33426. A suggestion I have that could bring more families together is a city splash pad playground area for the youth. And I don't see any other hands raised or questions at this time.
Thank you, John. One more round here. One more. Three.
Let me speak on what's really relevant now, especially with the ARP money. We already have about 7 million. Let me explain to you what we need over here in District 2. In respect to tutoring programs, we already have a Bulldog program with over 300 children. We already have a facility, that's the Hester Center. So now we're talking about, I heard her mention trauma-informed care, which you hardly ever heard, but we do have the program going over on the West Coast. And that is more important than just mental health in and of itself, because it catches someone, it touches someone at the trauma, right where it started from. Especially over here in District 2, dealing with Black folk, we're talking about the abuse from that systematically designed condition that we're in and having to live in. And so trauma-informed care is something we really need to really focus on, apart from but not excluding mental health per se, that deals with a lot of psychotropic drugs. You understand? So when you deal with where a person was hurt at, and they're upcoming, and they got someone that they can identify with in that respect, you have an opportunity at that time to see a changed person from the soulish realm, the mentality. Now, and that's the mind, baby. And so when we see a change there, you could see a change in their conduct, and then we could produce, you know, other than trying to control them with the psychotropic drugs that we normally do in mental health itself. So I really would like to be part of the stakeholder and part of that community partnership when we start spending this money for what we really need, especially in District 2, in respect to apprenticeship programs, that when you develop a skill, you can pay a bill, apart from just getting a college degree. And so there are a lot of, believe me, different skills that can be taught and turn out many. And I'm talking about in a period of 8 month and 11 and 13 month period of time. These are things that we really need in that respect. When it comes to judicial and criminal justice, we're talking about law enforcement and citizen police encounters, that kind of stuff that need to be addressed. So we need a committee in respect to that. We're talking about something in respect to a community review board to review, different departments of our municipality. But we're talking about effectiveness. And so we really do need to have someone to review, even though that in high departments like yourself, by the grace of God, to make sure that equity is there, that money is being spent fairly throughout this entire city. There are other things I can say that we need here. We'll talk about that in other meetings.
Thank you. And good point. Trauma did come up in a lot of our conversations. So we drift that is included right in with mental health. Thank you, sir. Mr. Magnoli, you want one more point?
Hi, Ernest Magnoli, 710 Northeast 7th Street, apartment 407, Boynton Beach, Florida. First of all, I think everyone knows that FIU is Florida International University. It's in Miami. It's a public research university founded in 1965. Basically, at least in my opinion, you put the timer on for me? Thank you. Basically, in my opinion, I wouldn't bring too many organizations from Miami to help Boynton Beach when Miami and Dade County are just examples of overdevelopment, lots of crime, big problems, the building collapse, etc. And the only reason I think that they may be here is because, from what I understand, the administration here is finished, and they're going down to Miami area to run for senators. So yeah, and the lawyers for the city, they're all like, their offices are down in Dade and Broward, and it's almost like, and then bring those developers, all those problem developers here. Boynton Beach doesn't need that. Boynton Beach needs a break. And, I don't care what anybody says from New York. I'm from the New York area. Boynton Beach doesn't need $3,000, $4,000, $5,000 a month high rises. It doesn't need that. What it needs is a lot of land and a lot of one-family homes that anybody can afford and live and raise a family and go to a good school and be able to walk in the streets and get all street lights around instead of dark streets and crime, etc. And get us a government that'll listen to us and not listen to out of county millionaire, billionaire developers. I don't see what they have planned for this Ocean Avenue as one positive thing for the city. And basically, for me, I never would have built this $118 million building. Who needs this thing? And you wonder why they have to develop, because look, they built this library. I've been all over the world. I've never seen a too big, too expensive library like this. And there's never anyone in it. And that's why they got to develop to pay for all this stuff. And who do we owe all the credit to? This mayor, the city lawyer. And they got all these things, put the city in debt for 100 years. So now what do you got to do? Now you got to bring in millionaire billionaires to start paying for all this stuff. It's just, it's not the way to go. And these areas, look, I don't agree. I've been for 50 years a graduate education professor. And let me tell you one thing. What you hear New Yorkers say about Florida, in my opinion, is not true. New York has probably the worst problems of all. Leave Florida alone. Florida is good on its own. Leave us alone is what you can do. If you want to move here, like me, I want to help what you are. I don't want to tell you that I want to try.
Thank you, sir. All right, Maria, you want to close us out? And tell us what the
David, we
next
have
step-
an additional hand raised online I want to get to. Mr. Loftus.
Yeah, I just want some clarity because I guess I just want to make sure that I understand the viewpoint of where you guys are going with a land bank, because it really sounds like a very socialistic in nature. Because I'm 38 years old and I'll be paying taxes to you guys for 40 years, and I don't think I want to be paying money into a land bank.
I just want to say that nothing has been adopted. We're discussing some possible solutions to the housing affordability problem in Boynton Beach and frankly South Florida. When we mentioned community land trusts, land banking, helping nonprofit developers create a pipeline of affordable housing, none of this is set in stone. So these are some of the solutions you heard from one of the other residents. There are opportunities, there are best practices that work, that create that supply of affordable housing that the community needs badly. But what we mean is that the city needs to explore various options in order to address the affordable housing crisis.
I guess to circle back to kind of a couple of what the other
Nothing to do with socialism. I just want to interject.
Yeah, just to circle back to a couple of the other individuals, it seems like the city wasn't too great at targeting some real estate opportunities. So why, if we were ineffective before in it, why should we double down or triple down on that?
Just very briefly, we're not saying the city needs to develop the land. There are plenty of nonprofit developers who work in that space and that we've spoken with that are interested in doing that with a track record of creating that pipeline.
By using tax rebates, right? Giving them tax incentives to do that?
That could be one option.
That's probably how it's mostly done now, correct? Which creates tax deficits when you have to increase our millage year after year, right?
That is one of the tools that does do that. The CRA has its own funding strategy as well. So there are different strategies to address as Maria said, the different strategies out there, best practices to help ease the housing crisis around affordable housing, and we're exploring all of those. And affordable housing. Let me just clarify it so we can move on. Affordable housing doesn't necessarily mean just low income. It means our community that is currently being priced out of their homes. It's right now, the high price of land is destabilizing some of our communities right here in Boynton Beach. And we understand that. So how can we bring the workforce of the future, your children, our children, their children, that have them live here if they can't afford to live here?
Sir, that's not your job. That's my job to take care of my kids.
I'm not talking about taking care of your kids. I'm saying ensuring that housing is affordable for future generations. It has nothing to do with you.
Because I'm going to teach my kids to make good personal choices and do well and succeed in life. So they don't have to rely on the government. Do you understand that?
As you should. But there are others, and I won't go into it because I've addressed it. There are reasons why we want to keep housing affordable, and that is for generations of people that make minimum wage or above minimum wage and can't afford to live here in Boynton Beach.
But you're not going to be able to do that. 30 years ago, a house was $50,000. Now it's $300,000.
Sir, and that's one, and you're making the point for us. So
that you're not going to be able to do that. It has to do with market factors. The only way that you would be able to do that as a government is by creating a socialistic environment, which is crazy. You just need to roll with the market factors that increase you guys. You need to work like this is just, I'm sorry, but that is not the way to go. And I'm not happy with the outlook of this city if this is what you guys are going to.
Thank you for your comment. All right.
Yes, we have additional hands raised. I have Miss Sheila Gaines.
Yes, can you hear me?
Yes, ma'am.
Okay. Hi, Sheila Jill Gaines, 2500 Consman Lakes Drive. What I'm hearing is that everyone has something to say about this study and what we're doing. And this is the input meeting, correct? Yes?
Yes, ma'am. Yes, ma'am.
Okay. So what are we going to do next? Are we going to compile all the information from the residents, go back to the drawing board and say, hey, these are the things that are important. We've spoken to our stakeholders. We've spoken to the community. Let's go to the drawing board and see what works, what doesn't work, and do what's best for the community.
Yeah, you're right ahead of me. We were trying to close out, but we had a few more
I'm sorry.
comments. No, you're right on point. So let me get a few more comments, and then we'll have Maria tell us what the next steps are, if that's okay.
Okay, my apologies.
Thanks, Sheila. No, you're perfect.
So next we have Angela Gertman. Ms. Gertman, you are self-muted.
Yes, can you hear me?
Yes, ma'am.
Okay, thank you. I would like to speak on the issue of affordable housing. When we say affordable housing, I think we need to speak of it in terms of workforce housing, because what's affordable for what in one person's eyes is not affordable in another person's eyes. So if we're speaking about equity, we need to also look at what we are considering as being affordable. Not only single family homes, but also apartments and apartments that accept children. Because I've been in Boynton since, I guess, 1977. And when I first came here with my family, one of the big things was finding an apartment that accepted children. They would accept pets before they would accept children. So one of the things that I think that we need to consider is single family homes, workforce, think of workforce housing instead of income, lower income or moderate income housing, to be equitable. What is considered affordable to the general public may not be affordable to some other persons who are in need, desperate need of that housing.
Thank you,
Yes,
ma'am.
you have to. I'm sorry. I was
Go
going to
ahead.
say you have to consider the working class people. Where are they going to live? People cannot afford to live outside the city and then drive into the city to work. Where are these people going to live? That's working for some of the people who are of higher income and who may not agree with the affordable housing approach that we're trying to take. Thank you.
Thank you very much. I just want to say that when we say affordable housing, it is precisely workforce housing that we mean by that. Housing that's affordable for people, for families within different household income categories. So we're not talking about, again, low income housing. We're talking about housing for your teachers, your firefighters, your small business owners.
Afford to live.
Well, exactly. We're talking about housing available for different income categories and housing options available for household for families to choose from depending on their lifestyle choices. Not everybody wants to live in a single family home. Some of the younger generations, their starter homes are typically apartments or smaller homes, townhomes. So we need to provide for people of different incomes and from different age groups and different lifestyle choices.
Are you still able to hear me? Hello?
Yeah, we heard you now.
Okay, just one more thing. You mentioned teachers. I'm a retired educator and I have lots of friends that are teachers. Most teachers that I know have at least 2 jobs and still cannot afford an apartment in this city. So as you're talking about affordable housing and you happen to mention teachers, I am in complete in agreement with looking at that population. Thank you.
Thank you very much.
I don't see any more hands raised or questions at this time.
Maria, you want to talk about what our next steps are.
Yes, the final point I want to make before thanking you again for joining us and your comments and feedback and your continued involvement, I want to emphasize the process doesn't end here. What we are in the midst of is developing that report, which compiles all the data that we presented here and much more, including various other groups, Asians, Pacific Islanders, people of different religious beliefs, people with disabilities. You heard from one of the residents that that's also important, seniors. So all of these diverse groups, we will include data on them. And then based on your feedback, based on the feedback from the stakeholder meetings and the survey data that we'll be collecting over the next couple of months, we will use all of that information, all of these comments to come up with our recommended strategies for the city to explore as it focuses its resources, as it prioritizes its decision making over the next several years. We won't come up with one strategy per pillar, and, in terms of education and economic opportunity. It will be a menu of strategies to choose from, to explore further, and to engage community partners on. David mentioned earlier, the city cannot do it by itself. It needs you, the residents, to speak up, to participate in these meetings, to give your feedback. And it also needs the organizations that are already vested in the community and are doing a lot of this work that probably needs to be enhanced and supported further. So again, in terms of timeline, we will be producing that final report in January, probably by mid-January, at which point we'll probably present it to the commission. And if you left your contact information, we will send you the survey. We will send you an update on our progress of the report, and you can come and review the final document and speak on it at that presentation. Sir, just a brief comment. We are closing the meeting.
Ernest Magnoli, 710 Northeast 7th Street, Boynton Beach. Is there a chance that your report and recommendation could be in March instead of January? This way it could be with the new administration, the new mayor, the new commissioners. Instead of letting this one for 6 years, maybe enact it. So hopefully you'll delay it until March. How's that? I'm asking, please.
Well, that's the time frame, Mr. Magnoli, is that the report will go to this commission in January. But to your point, there will be a new commission in being elected. 3 of the commissioners, the mayor and 2 commissioners, are termed out. But the budget conversation continues. So if there are any policy recommendations to go forward, the new commission will be part of that conversation as well. So absolutely, it will continue through the changeover in commissions, and that's anticipated in March. So, and again, because they're long-term, short-term, and long-term recommendations, this will be an ongoing conversation, not only for this commission, the next commission, and future commissions. So it will continue on. So we thank you for your input. It has been very positive. We appreciate each and every one of you. We accept your recommendations, your comments, your suggestions, your criticisms as well. But we're here for that, and we want to make sure that we have included what you think is important for the city of Boynton Beach. And so I thank you. And John, you want to close us out?
Yes, thank you, David. As a reminder, a recorded version of this session will be posted to the City of Boynton Beach's YouTube channel. Links to that channel are available on the City of Boynton Beach's website at boynton-beach.org. This concludes today's City of Boynton Beach Racial Equity and Social Equity Community Assessment Public Input Meeting. On behalf of David Scott and City staff, Dr. Maria Ilcheva and FIU staff, thank you for attending. Be safe and have a great evening.
Thank you. Thank you.